Hi, everyone. My name is Kaisha Buckham. Dialogue That Matters was started honestly to create conversation, community conversations, especially when we talk about the Black and Brown community. We lack the education of how to take action when we talk about community wellness, mental health, finding a primary care physician. So, the idea behind it is to find our health and wellness providers, put them into the same space, have these conversations, but also behind it, provide you guys with actionable steps in order to know what the next step is to take. For instance, if you need to go see a primary care provider, what's the step that you need to do? If you feel that you are depressed, what do you do and what's the next step to take? So today, our topic is community wellness and mental health, and we're really going to dive into COVID-19, what it did, the experiences of the pandemic, and where we are now. And we have two of our guest speakers that are both in the health and wellness field, and I'll have them introduce themselves. Start here.
Thank you. Hi, everyone. My name is Diamond Wallen, founder of Wallen for You, and I'm a licensed master social worker.
Thank you.
All right. Hello, everyone. My name is Dr. Renisha Nichols. I'm also a mental health provider, founder of Reset and Restart. And I've been doing this for about 15 years and counting, been in practice for 9 years. So I'm excited to share and really help the community.
Okay. The first question that I wanted to really kick off this conversation is what is mental health to you and what does mental health means to you?
All right. So mental health means to me is basically how I feel about myself and how I view myself, how I wake up in the morning and how I tackle the new day. Mental health is how I show up for others, how I show up for my community, how I show up in the workforce, how I show up for my daughter, how I show up as an oldest sibling, for my younger siblings, for my mom. So mental health and taking care of myself and doing the right things to pour into my cup and nourish myself is how I view mental health to be able to be a good person in society.
I like it.
Yeah. So I think sometimes mental health can be such a complicated term. So in my efforts to put words to it, I want us to just think of our brain as like our processing center, right? And our brain literally takes in information both internally and externally. So everything, all our senses, everything we see, smell, touch, feel, our brain is processing that information. And then internally, all our experiences, all of our emotions, everything we feel, everything that penetrates our heart, our brain is processing to figure out what kind of decision making, how we're going to move, how do we see the world, how do we see ourselves. So when we talk about is it healthy? That's a huge part in terms of if you have negative experiences and you're seeing the world from that lens and you're not addressing that, you're literally living life in an unhealthy thinking process. Versus on the other content of it, if you're purposely putting in positive and healthy content, it will help contribute to a positive mental health standard with the things that you're seeing and the decisions you're making is coming from more of a positive, nourished mental health status.
I agree. And I think we talk about mental health. It's a conversation that we don't like to have. And I'm talking about when we're talking about corporate work, especially in our household, we don't really know what mental health really means or what it means to have healthy mental health. Um, so the first topic I kind of want to dive into is how do we know when we're not mentally well and mentally stable, right? Because I feel like we can go through the day feeling okay, feeling happy and smiling. I feel like we see it more and more so where suicide is at its all-time high, but you would never know. Everyone's first thing is I never knew he was depressed. I didn't know he was sad. Like what happened? So what do you tell someone like how do you know when you're not mentally stable?
Blessed day.
No, I mean anyone can say I just
I mean, I think, we all have that subconscious voice that we're hearing. And if that voice is constantly negative to the point where it's impacting your daily functioning, I would say it's not healthy. And I think if you think about your physical health, right, how do you know you're not physically healthy? Usually you have signs and symptoms. Something's not functioning the way it normally does. Well, it's the same with your mental health. You're not thinking in a manner that's going to be productive. You're no longer having the desire to do the things you want to do. You're losing motivation, and you're literally losing your zeal to live in your purpose. I think those are some of the signs that your mental health is not going well.
Right. And just to piggyback off of that, I just find myself, because we all go through it sometimes, and you find yourself in a loop where you're just finding yourself unmotivated, like you say. You're not wanting to do the things that you normally do, or you're spending more time in the bed. You're on your phone a little bit more. You're neglecting the self and making sure, and neglecting the things that make you happy. You're noticing that if you're a mom or a father, and you're usually playing with your kids, you're noticing like that you're getting irritable a little bit more. You're like checking in with yourself, like, what's going on? Why can't I do the simple things I used to do with joy in my heart versus now? And now I find myself, finding my child to be annoying or irritable, or I'm giving her the iPad so she can just sit down and I can take up her time more than interacting. So I find myself, if I'm feeling like I'm going toward more poor mental health or not having a good wellness day, I find myself to be more in a loop, in the bed more, binge watching shows or going outside and just hanging out a little bit more, neglecting my responsibilities, making positive decisions to contribute to the next day, being responsible, knowing that I have to wake the kids up. Should I go out tonight? Would that make more sense? So just doing things that's causing me to not really care about who I'm hurting or if I'm even hurting myself.
Yeah. When we talk about COVID-19, during COVID, I was in school. I did pretty much like all of my clinicals throughout school, but COVID was terrible. We all know that, but the aftermath of it, right? I kind of want to dive deeper into it when we talk about the trauma that happened after COVID, during COVID. Um, I feel like after COVID, loneliness increased, right? Because we were inside more, we didn't want to be outside. We kind of became so comfortable being to ourselves, that it became a norm, but we're not realizing that we're actually depressed and that we should go outside and enjoy nature. But also the trauma that we all endured during COVID. Like for me, for example, while I was doing my clinical rotations, I lost multiple patients. But even within that, I lost family members, right? But you had to keep going because it's just like time is not stopping for you, but no one really talked about that, right? It's like you got a phone call and you're like, okay, grandma died. And then you had to keep going. So I feel like that's a big part of it where we were just going with the flow when it came to COVID-19, but we didn't deal with it. And we're still not dealing with it. We're just surpassing it. And then I really want to pinpoint the Black and Brown community where we're talking about COVID. So both in your fields, what you're doing right now, how do you think that COVID had impact your work? Do you see people coming to see you more, um, taking more advantage of their mental health, or do you see that we're still in trouble?
So I mean, COVID, and it's such a big array because everybody had a different experience for COVID. But you mentioned Black and Brown communities, right? And so that's where the contagion level for COVID was high. So we had more losses. Um, there was more disparities in the sense of our people are the essential workers, so they weren't necessarily home or had jobs where they can be a stay-at-home parent. And then you had these children who are online learning without a parent or without the supervision. And so there's some lag there. And so when you put that all together in terms of the impact of it and then trying to recover with minimal resources, I think we have a huge gap in the sense of how people are recovering from COVID. So if you were home and you were working from home and you were able to keep your financial status, pay your bills, people were safe, people didn't necessarily have to go out as often, you probably didn't experience it for someone who was living in an apartment building and they were congested and their parents had to go out to work and maybe they were bringing home the virus and things of that nature. We're just a whole different experience. So with that being said, the anxiety level raises where you're watching the news and all of these death rates in addition to your own personal experience. And then we had other things happening during COVID. We had police brutality, we had political uproars and upheavals. So it created a space where you really felt like you had no control over what was happening next and you were losing people by the moment. So your sense of hope and what the future looks like, there's a lot of people who didn't see today because in their mind, those circumstances was never going to get better, right? It was just unbearable. And then for those who were able to see it through, they can't forget that moment, right? And you never know when it can happen again. As soon as people are like, oh, it's COVID spiking again, what that means to different people is completely different. And so the anxiety, the depression, the trauma, the grief, the loss, and then you're taking that all and being like, all right, let's get back into the world. Let's start it all over again. And people are like, how? With what? Right. And I think, unfortunately, mental health has been commercialized through COVID, but we can have that conversation.
Yeah, I agree. I know you mentioned that in my eyes, I feel like toxic stress became it just increased in each household. You don't know what to expect. You try to plan, you have your daily stressors, you know how to plan and go around those and, make accommodations. But now it's like you said, grandma died and it's like, you can't go and visit, you can't say goodbye. And how do you internalize that? And how do I now view the world more hostile? Like, how come you couldn't allow me to go see her and do that? So now I have built up anger. I work with youth and a lot of the time, schools was a safe space for them, and being able to leave the household because there's a lot of abuse or trauma, relationship problems going on within the household. So they use school as a place to get an escape. There's a lot of, lack of healthy foods options in the household, financial responsibilities. You have social workers going into households to provide resources to bridge those opportunity gaps. So a lot of the kids lost that. So I was in school as well during COVID, and I was actually carrying my first child during COVID, and it was a lot of different stress with the world closing and then finding different innovative ways to still teach kids and still be engaging, to want them to come online and raise their hand and laugh and to see them smile knowing that they're not going to actually feel my touch. So I found like the kids were really lonely, isolated, they gave up. A lot of them actually, the high schoolers, they actually went to work. So then when they said school is back open, they're like, school or work, school or work. So now they're juggling like which one is more important, because I was adding more financial gain in my household and now you're telling me to go back to school. So now us as, educators, it's like, how do we now accommodate, the loss of income for bringing our high schoolers back into the school system? How do we now see that it's more than just school? At 320, we still need more support for our students outside of it. So I feel like, there needs to be more innovation, creativity, advocacy, mobilizing different community partners, more dialogues like this to spread awareness of the different effects in the household. I mentioned the abuse and the trauma and the neglect, and then, substance abuse has increased a lot. So people are coping with unhealthy habits and keeping them in that loop, and they're not catering to their mental health, but they're like, at least I'm numb right now, and then the cycle repeats. So COVID, it put a light on that poor mental health was already on the rise, but it showed it more as, okay, this is very important. Kids are saying, forget this. I don't really care about high school. I don't really care to go back into the buildings. I'd rather do something else that's going to feed me because I don't know if I'm going to be here tomorrow. So they lose that optimism, that glory within inside to feel like I can continue to want more, but I'm not sure if there's going to be more.
Right. One of our community members mentioned something. So we know health disparity is at its all-time high, always been. And I want to say that it won't always will be, but working in the hospital and seeing that quality health isn't provided to everyone, access is not always there. And just because you need help doesn't mean you're going to get it. Right. So like my goal within this space and with this dialogue and this conversation is to provide that help, right? Because not everyone is going to go and see you guys, right? Not everyone is going to feel comfortable to make an appointment and see a therapist because that's not what they know. That's not how they were brought up. So we have to create different platforms like this for people to tune in, for people to be here, for them to understand that this is still you doing something for your mental health. Right. So how do we as educators, providers, community members, how do we reach those people, right? Because if I know that I'm depressed today, what's my next step, right? What do I do? How do I reach you? Or if I don't have insurance, what do I do, right? Because we know that's a huge thing. Okay, I know that I'm depressed. I know that I need help. And I know the next step is the next step to go see my primary care provider? Is it to find a mental health person that can help me? Do I need to pay out of pocket? Do I need insurance? When is it too late, and what is the next step? Like, what do I do?
Well, so for me, I'm really passionate about social injustice and just raising awareness about the topic. So fortunately, while I was in school, I was able to learn more about our ACE scores, which is adverse childhood experiences, and being able to educate all. So not just me understanding and knowing what that is. So for those who don't know, the ACE scores is a series of questions that ask to get to understand the trauma and the background and different experiences that an individual experienced within the household or within the neighborhood. And as a practitioner or as a doctor, you want them to understand what ACE score is, because we can start adding that towards our screenings so that we can start bridging these gaps and referring out and understanding like, okay, this person scored an ACE score of 4 and higher. With that number alone, there's different life expectancies. There's different things that we can proceed that is going to happen because of the trauma that you face. So making sure that a lot of people are educated and being able to minimize always just going straight to a social worker. There's other avenues that we can help others be more educated around, and being able to add different screenings to be like, okay, this is a red flag. Let me call a clinician from upstairs to come down and check in with this family, see if there's any research that we can provide, if there's anything in the neighborhood that they need, have that one-on-one conversation to make them feel heard about their experiences. Black and brown people, we go to the hospital sometimes. Maybe we don't go to the hospital all the time, actually, because we find ourselves sometimes you just got to be so strong. And I come from a Caribbean background. It's like, go drink some tea and go pray and go lay down, or go put a hot rag or a cool rag and calm down. Or it's like sometimes you like to block out the pain, so we'll listen to music. And then I remember I was in class one time and I was watching a video, and this lady, a black lady, she was going to the hospital. She had chronic pain throughout her entire body, but she was going to the hospital. She's listening to loud music to block off the pain, and a nurse seen her. They thought that her pain wasn't real because of the music that she was playing in the car, but little they know that was just a coping mechanism for her. So just being able to train people, broaden the perspectives, have more conversations, and teaching others how to advocate for themselves. Sometimes we try to watch our mouth so much because we don't want to say the wrong thing and you don't take me seriously. So how do we start making our black and brown people feel comfortable with our practitioners, with our different avenues that's supposed to support us and contribute to our life in a positive way?
I think that's key. How do we make us, our black and brown community, feel comfortable with the providers, right? Because I feel like as providers, sometimes they forget that they are literally supposed to be the safe haven, right? You're supposed to be there to educate your client, your patient. You're not really there to judge and just to diagnose, and you're supposed to educate them on what they're doing and make them feel safe. What's your talk this on?
Oh boy. So there's so many. So first of all, social work is such a broad profession, right? So you have 3 tiers. You have micro level, which is usually counseling, individual pieces, and then you have meso, which is more like community based, and then you have macro, which is the systemic piece. So the only reason why I am now Dr. Nichols is because I'm trying to attack the systemic piece, right? Because unfortunately, there's so much attention put to individual, and the reality of it is black and brown folks are struggling because the system does not support them, right? It's not just because something's wrong with us and we just, we're human like everyone else, but the pressures on us is greater because the system is so broken and it wasn't designed to include us. So somebody has to address some of that, right? So sometimes it's frustrating, I think, to come into sessions where you're focused on just the individual pieces and you're not looking at some of the bigger issues that's contributing to it, right? So I think it has to be a threefold piece. Now, I'm all for counseling, don't get me wrong. Like I'm all for counseling. And I did mention that after COVID, it's somewhat been commercialized. Some people are just home, racking up some insurance money behind on their couch and then not really doing work. And I'm not saying that there are social workers who are doing telehealth and they're doing great work with telehealth, but there are some I think are more so benefiting for their own personal reasons and they're not really going beyond those 4 walls. Because even as an individual practitioner, I find myself calling schools, I find myself speaking to parents, I find myself trying to figure out what's happening behind the closed doors. They also need an alliance, they also need an advocate. It doesn't just happen in those four walls. So I think when it comes to how people can get support, I think we have to really blend all 3 together, right? We need advocates on all levels. I think in households, families got to do better, right? children need stability, right? We got to look in our community. Our communities need stability. We need to kind of restore what we've lost. We don't really have our own. This is why it's so important to support our own, like, Black-owned businesses, to be a solution to our own problems. I know we make joke about the ginger tea, but there's some truth to some of the herb
Yes,
stuff, right? There are, right? And
I will
feel like,
recommend it to a child.
but it may not be 100% healing properties when you're in a crisis, but it could be definitely, preventative solutions. And it's funny because now we see there's more of the natural remedies coming to our health, right? But unfortunately, it cannot be only used in a crisis situation. It really has to be preventative. So I think we have to start bridging the gap from now, because unfortunately our Black and brown people are suffering because they're waiting till they're in a crisis to go get seen. So look at we have liquor stores and bodegas on every corner, right? We don't have the healthy grocery stores in our community. These are the places that we got to begin advocating for. These are the change systems that we have to start having.
I was thinking about that because we will work. We don't have access to bank accounts as often. So we'll go to a check cashing place. You leave a check cashing place, you look down right to your right, there's a liquor store right here. And it's like, why not go inside the liquor store? It's Friday, you keep that same loop. But that was placed there on purpose for us to be able to stay comfortable and just have this same routine, so you're not aware and alert of financial freedom, financial gain. What does it mean to invest? What does it mean to, save money and to have a life insurance policy, to take out things for your kids, to think big picture, to have generational wealth. I'm learning that all right now just because I'm just looking around a little bit more like, how can I get that? But it's something I've never seen before. So it's always a system that's in place, the poverty cycle, and you have that generation that just want to break it. But you're like that one person in your generation, in your family, that wants to break it. So it's like, who do I turn to? So now we go to different avenues like this, and I get to learn from you all. And I'm getting to see different ways that we can have a great life, but it's more, discussions and dialogues and educating people from younger so their brain can take it all in, and then they're able to now do this for themselves.
You both touched on something important. The first thing is preventative care versus intervention, right? And I feel like within this community, we know intervention when we are feeling pain, when we are having a manic, like that is when something happens, right? So we don't take the steps to take care of ourselves, whether that is yoga, massage, going to church, relaxing, self-talk, positive talk, journaling. um, it takes us to the end of break-in before we say, okay, now it's time for me to take care of my mental health. Um, but the bigger piece of that is like, as providers, community members, we have to understand cultural awareness, right? Every culture is different. Every person is different. Every individual is different. So it's like, to get to that step, if we have liquor stores on every corner, if what we see was just deal with it, crying in the corner, come out and get the work done, we're not going to know that when we go to a different town, they have wellness centers everywhere, right? Therapy is normal. Like being in the household and having conversation at the dinner table is normal. But these conversation about depression and mental health to us is like having a conversation could be traumatic for someone. Like it's too much. Like they don't want to talk about it. It's stressing and they think they're being attacked, right? And then the other thing that I liked is the resources. Um, I always say that we have a lot of resource, but it doesn't mean that it's accessible, right? And one of my biggest goal is to have people like you both within one space. So when someone asks me a question, I can say I have a resource to that, and you have access to them, right? Just because there's resources does not mean it is accessible to everybody, right? Just because there is therapy out there, there's counseling out there, it's not accessible to everybody, and we know that because insurance is not accessible to everybody. When we're talking about immigrants, Black and brown people, it doesn't matter. It's not accessible, right? And it's getting even worse now because when we talk about Medicaid, a lot of our primary care providers, our therapists, they're not accepting Medicaid anymore. So it's just like, if we're in a community where um, Black and brown people, the lower class, they look to Medicaid, and now their providers aren't accepting it, it's just like, now what do you do? Right? So it's just like, how do we make it accessible? How do we make it reachable? And how do we break those barriers from being systemic? Because it wasn't set up for us, right? again, like being inside of the hospital where you're like, there's so many different tiers to mental health. As a nurse, I feel like a lot of nurses feel like psych and mental health is not in everything that they do. If you're in med surge, they feel like mental health is not there. I'm just dealing with the patient. I'm just fixing their issue. But I feel like mental health is in everything you do. Like it's in a literally, it doesn't matter what your specialty is. It doesn't matter if you're in the school. It doesn't matter if you're in the hospital. It is there. But the issue with that is even as nurses, are they equipped to understand that person and respond to them correctly, right? So like for me, I work in the NICU, and when we talk about postpartum depression, when we talk about anxiety, when we talk about stressors, we are focusing on the babies, but it's like when we're looking at mom and dad, do we know how to respond to that, right? Because ultimately, they are going to go home with that child. So it's just like, what do we do for them in that stand, or how do we equip our providers, because we are providing the care, to understand how do you respond to anxiety, right? That person might come off disrespectful, but they're just, they're in a very intense situation. So I feel like a lot of people don't understand that mental health is connected in every possible way and in everything that you do. And it's like, if you can't show up, what's going to happen?
Yeah. Right. Yeah. I don't
No.
even, I mean, I think it's there's not one solution, right? There's a lot of work to be done, but I think it goes back to ownership, right? When we're talking about culturally relevant providers, I think it goes back to ownership. So I think we have a vulnerability being the clients of people in charge that don't look like us, where that makes us very vulnerable, right? And so I think about our schools, right? If you go to an affluent community, you're not seeing a predominantly staff of people of color teaching, Caucasian students. That does not happen. But if you come to the urban community, most of the staff don't look like the students, right? And that's just one systemic reality. And then we go into the health system. You have something similar, right? Those who are working the floors may look like us, but the people who are doing the surgical procedures or the ones who are running the bills or they don't look like us, right? So it creates a vulnerability. So I think we just have to work hard to be in positions where we can advocate for those who are in more vulnerable positions, because we know that especially women of color, when they go into the health field, they're usually minimized in terms of they're fine, they're strong, they're good. And a lot of them have lost their lives because their pain has been minimized. They've been sent back home, or things of that nature are not taken seriously. So there's just things I think we just have to do better at in terms of our ancestors made a sacrifice. You mentioned people becoming really self-absorbed and being individualized, but I think we have to see the bigger picture in terms of the big need as to why we still have to work collectively to make this change, because we have another generation coming up. I think if everybody kind of sticks to this individuality piece, we lose sight of making real change to support those who really need it. So.
Yeah. I know. No, seriously, there needs to be more collaboration, more shared leaderships. And first of all, like you said, with resources, it's not until I started going to community realizing like, wow, there are a lot of resources out here, but no one knows about it. Or a lot of people are reinventing the same wheel, and they're like trying to profit for themselves instead of collaborating with others to be able to reach more of a broader audience. When it comes to, I remember me just being in the school system as a kid, and I did have more predominantly white teachers and educators, and it was fine until certain questions like, why are you bringing a blue drink in here? Or like, why are you eating a bag of chips in the morning? It made me realize, oh, you don't know the population that you're working with. So, but it was good for me because I think that sparked my social justice and my will to be in social work anyway. So I was thankful for that. And the lady was so open. So what we did was we actually went a tour of the neighborhood, and she talked about how sometimes I just go from Avon, go over the mountain, come down the avenue, and I go right to work. I don't look around and see like all the things that we see in our realities. The playscapes, what our neighborhoods look like. So being able to take her around, and she's like, there's not one grocery store in here. There's not one grocery store, healthy, different healthy choices. I do see a lot of corner stores. I do see a lot of liquor stores. It helped her to now be an advocate for the different type of things that we were experiencing. So being able to teach others and in hopes that they're able to spread awareness about it as well, making people reflect on their own implicit biases that they may have, or ignorance towards the mental health and the lack of needing to be educated in this area because you think it's not part of your job or part of your profession. But if you're able to meet needs and make connections with people based off of, the type of conversation that you have, it opens up so that you can find out more about the person, and then you're able to pinpoint exactly what the need is. They can say I have an ache in my back, and you're like, okay, what's going on with your ache in the back? But it's really just coming from stress. But you would never have known that. Now you're providing them with medication, then they're getting hooked on the medication, they want more, and it continues that cycle. But if you have just connected the dots and probably called up to the 4th floor for a clinician to come downstairs, you would have noticed like, okay, this person needs more than just a prescription. We need to build a team around this person. So just being able to go into these rooms, into these spaces, and with your chest high, your head high, and being able to advocate for yourself. We can't just talk to each other about it. We have to go into these different cultures and these different backgrounds and be able to explain what's going on and how you can be a support as well. Because of what my teacher did back in middle school and high school, now it's a new thing. They're taking teachers on tours. We're trying to change school culture and education and give them more of understanding of what's going on in people's lives so that you can better fit the need in the classrooms. We're noticing that a lot of referrals are going out in the school systems. So instead of just 2 social workers, there's like 600 kids in here. What do? We start training our teachers to now create safe spaces in these classrooms, creating different worksheets and referral forms where now we can get a quick little synopsis of what's going on and how we can be a resource in the classroom before you start saying, okay, you need a therapist, you need this, you need that. How can you make yourself as use and not just come in here like, okay, I'm teaching math today, that's it. That girl keeps sleeping, I don't really care about that. That boy, he keep throwing his chair. No, he throwing the chair because he don't understand it. You keep calling on him. He doesn't want to be embarrassed by his peers. How do we broaden our perspectives and think a little bit more of the why and not what's going on? Not just the what, but like, why does she keep coming here sleeping? Hey, let me talk to you. Kids and everybody likes to be seen and like to be heard. It's like, oh, you talking to me? Like, you notice that too? I'm always in here sleeping. Yes, miss, let me tell you what's going on. Yeah, I'm so hungry, so I'm tired. Oh, we have a market right in our building. Go right over there into that market. We got fresh food. You can go eat over there. And now the kid is happy. She's building a relationship with you. She wants to go to your class. Her grades are improving. The way she responds, her confidence, she's thinking more critically, all because you're looking at a little bit more of the why and what's going on versus like, oh, she don't care about her grades. Forget it. I'm just here to get my little tenure. That's it, So just having those conversations, being able to advocate, and for us to go into these communities, into these spaces, and to be able to speak up for others too. And for them to understand, hey, we got a little bit more work to do. Like, how can I support you? So I actually started doing this thing. I'm actually going into schools now, and I started developing this curriculum called Teach with Love, to be able to go into the classrooms and be able to cultivate these safe spaces in each classroom and not just have that one teacher that they find is the cool teacher. I was the one teacher. And it's like, everybody come in here, but this ain't my job description. So it's just like, how do I make more of me in here, So it's like, how do I be able to, it shouldn't just be everyone wants to come to Ms. Diamond's room. It should be everyone wants to go to this classroom. I want to go to that classroom. I want to do better. So just being able to not just say, I need you to do better, but now how do I check in with these teachers? How do I have monthly workshops and monthly or bi-weekly, not bi-weekly, or bi-monthly, because not everybody's going to come to these events, but being able to cultivate shared leaderships. A teacher saying, hey, I noticed that I'm having a hard time with this student. What did you do to make it a little bit better? And now you're talking to each other, sharing strategies, sharing coping strategies, different resources to help with your engagement. If everyone's just so focused on their own bubble, how are we going to know what's working, what's not working without talking? So it's going into the rooms, having the conversations, but then following up. How can I be a support with you so that you don't feel alone or feel overwhelmed because you're like, oh my God, this mental health stuff. And like, someone come back and check on me because I need some support as well with my own, with what I'm hearing. Because some of this stuff really do be heavy, and they need an outlet as well to say, you know, this is some heavy stuff and I want to be a support, but I need support as well while doing this.
So honestly, like from both everyone is saying, it's all connected, but I feel like the takeaway from it should really be that it's not just someone is depressed, someone is angry, someone has anxiety. It's all connected, and there's a way that we have to break it down to get to that source, right? From the root. Like it all starts somewhere, and where we continuously continue to go, it builds up over time. So again, the idea for these episodes and for these conversation is for people who don't feel comfortable to go seek a therapist or to get help, another platform to understand that if you're saying families, we need to do better, right? But how do they do better, right? So explaining and breaking it down that your daughter or your son isn't just acting out, right? This is probably what's going on. So it's like having these conversations, but also giving people the confidence to advocate for themselves. Because it's easy for us to say, look, we can be advocates, right? We went through school, we did it, we're in the hospital, we're in the community. It becomes easier. It's not easy. It is not easy. It's actually very stressful. um, but it's easy for us because we have a knowledge behind it and understand what we're saying. But when you are the patient, you are the person that's going through, it's not that easy for you to advocate for yourself, right? When you're that mother that don't want to have a C-section, but they are forcing you, how do you say no, right? How do you say no to the provider and the people with the knowledge in the white coat, right? How do you advocate for yourself if you're depressed or you're having an anxiety attack and they want to put you on a 72 hold? Is that correct? Right? How do you advocate for yourself when it's just like you just want help? Right? So I think even with that, I kind of want to end it with and kind of close it off for you guys telling me what do you want for the community? Because you're both in the community right now. And I just want you to kind of explain what you currently are doing in the community right now, but what would you like to see? Right? What would you like to see that's happening within 2024? Where's the love? What do we want to see? Um, what do we want to see change? Whether that's change, collaboration, communication, advocacy, more conversations. How would it help you to close these gaps in the systemic that's not meant for us?
Cool. These are some heavy questions. So, I mean, honestly, I think, so we're outnumbered. The demand for mental health providers, we won't be able to meet them one-on-one, right? So we need other types of leaders to step up. So when you ask me that question, we have to go where our people are. So we need to strengthen even like our coaches, right? That's where our team, that's where our youth are, right? They're on teams, they're on sports teams. Let's strengthen our coaches to be able to talk to them about, you know, real stuff, real conversations. They're close to their, you know, players or their teammates. So that's an example of something that's innovative. But I remember trusting my coach, like being able to feel comfortable and safe and, right? This person poured into you. Mental health doesn't always have to be the traditional form of what we create it to be. It really has to be a person who has the skills to identify this person is not acting their normal self. This person needs some support. When you mention someone getting to a point of crisis and no one knowing, that's a scary statement. This person is going to work, they're going to school. People are seeing them, they're contacting them. You can't tell me that there's no inkling that this person is not acting their normal self. We should have hubs in work environments that we know are stressful for your employees. They shouldn't necessarily all have to do individual therapy, right? And our work is looking different, where people are working with no insurance, right? They have no benefits. They are working 3 and 4 jobs, you know, and they're not getting benefits. So these employers need to make it a point to have spaces where they have access to at least someone to be able to say, hey, if you have anything going on X, Y, and Z, this is at least a place for you to be able to say, you can get some resources, right? I'm a little nervous with the church because I love God. I don't want nobody to come and strike me. But I think our churches also have to have relevant conversations where families are. It should be a safe space where families can come and say, whether it's a pastor, and the pastors really do have a lot on their plate. So even having other providers in their church be able to say, as a resource to our church community, if you need X, Y, and Z, this is a safe space for our church. And the list can go on in terms of those spaces that we don't, barbershops, the hair salons,
Exactly.
people just be talking at just, right? It happens, right? So we should really take advantage of, this is where our people, this is where they are. Can we have healthy conversations to really help people get going? Our music is a whole nother ball game, but that also influences mental health. And our music genre has changed where I think sometimes it's a distraction. It's words of destruction as opposed to music that actually pours in, and it's a message that people can actually be motivated by and take something away. So there's a lot of different avenues to support people's mental health. And I think as a community, we have to be more intentional about what we're pouring in to support one another. And that's what I mean by selfish. I'm not going to just make a record that's going to be motivating my people to drink, smoke, and be destructive just so I can make money. Or can I put something out there that's going to be meaningful, that can help bless somebody? And I know if we think about previous artists, if you look at their lyrics, they're speaking about relevant stuff to really motivate a set of people. So I just think we have a lot of we're creative beings. I think we have a lot of creative ways to really support people's mental health. We got to get back to that.
Yes, you do. I like that because my brand is about shared spaces, cultivating safe spaces in different environments to be able to have these conversations. Like you said, it can't just be referral out to a mental health therapist or to a social worker. It could be your mentors are now seeing these themes, seeing these patterns. These coaches are seeing the themes and the patterns and then be able to voice out and say, hey, I'm noticing X, Y, and Z is going on. How can we be your support? Because they're right there in front of them. They know them more. My basketball coach, I still talk to her to this day, and she knew me more than I saw my actual social worker. There's a safe space. There was a trust already there. So how do we have these safe, trusted places and be able to capitalize and build upon it? So what I would like to see more within our community is, and what I'm trying to do as well, is learn more about the research that we have out here, the different platforms, the different organizations that we have and the services that they offer and the requirements of it, to be equipped to be able to refer others to, or to have conversations with their staffing over there to ask them more about, how can we mobilize each other to help bridge these different opportunity gaps. Being able to go into the school systems and say, hey, I have a problem going on right now. That's what I'm actually working on. There's not a problem, but we're noticing that our elementary students are having a hard time to middle school, especially because when they're elementary, that's when COVID had hit, and they were on the computers, and they just wasn't getting that interpersonal love that they needed when they are inside the school systems. So we came up with an academy, we're still in the same school. We're going to use these 4 rooms right here and make it their own little academy before they get into, before they're actually in 7th and 8th grade, so that their mind, body, and soul feels a little bit better. There's more confidence going in. So just being able to go into these school systems and saying, what can we do within your environment to create more safe spaces? What is it that you need in the classrooms? What is it that the teachers need? Is there a monthly workshop that you need so that we're able to just talk to them? And I'm not going to come tell you what to do. Talk to me. What's going on? What are you noticing? What are you having a hard time? We need to bring back joy into the classrooms, into the neighborhoods as well. Getting people excited about the work that they're doing and why they're doing, and having that purpose of the why they're doing what they're doing, so that when they are talking to our young people or talking to families, it's with passion, it's with excitement. They want to see you win, and that family's leaving like, oh, okay, someone's on my team. She really sat with me, saw all the way through, and made sure I got what I needed. I can go back to her. Or I'm going to tell my friend about this person, and I'm going to tell another family about how we can do this. So just being able to build trust, safe spaces, being able to talk to other providers, talk to different organizations, our local Ys, our local, our Boys and Girls Clubs, different areas where our students hang out with, and what can we do to help them, develop a sense of self, develop a self-determination, bring back optimism, bring back protective factors to promote that resiliency, to be able to be like, I can do this. View their stress as, it's not doesn't define who I am, but what it is I'm going through, and how can I shift my perspective to view my circumstances as a standing ground to want more, to be able to, okay, this is my now, but who do I want to be when I'm present? So just having those type of conversations, and then right now just utilizing social media too, to be able to, we're trying to do, promote, put more videos out there, more tips, more tricks. So, hey, I need motivation. Oh, I click this page. Wow, there's a lot of good things on here. I want to keep going back to this page because it helps me feel, good about myself and how I could start my day off before I, enter into the world. So just being creative and capitalizing what we do have, because we have great things going on, but not a lot of people know about it. So being able to raise awareness about it and reach an audience where now they're telling a friend to tell a friend to, like, hey, check that out. That's really working over there, and I want to do more of that. So, yeah. It's a work in progress, but as long as people are working towards it, and not giving up and saying this is my end all be all, I want to continue to pour into it.
Agreed. Like I said, we have work to do. There is a lot that we need to do. But again, we can't do it alone. I can't do it alone. You guys are two amazing individuals, and there's so many more that I would love for everyone to meet and see and understand what they're doing in the community. Because that's the issue. We're all doing it, but we're doing it separately, right? So it's just like we're trying to understand why we're not impacting, why we're not reaching people, but we're not cohesive. We're not working together. We're not developing a plan together. We don't know who to refer out to. We don't know who to reach out to. And when we talk about health care, health and wellness, and community building, public health, we cannot do it alone, right? And in the Black and brown community, we're always going to fall flat on our faces if we do not come together. Um, so again, using these platforms, finding these people and sharing our not only our knowledge, but the resources, accessible steps and actionable steps of what to do is the reason why Dialogue That Matters is here, right? To make sure that they know who you are, what you're doing, how to reach you, but understand that we're actually out here doing the work and putting in the work, right? Because there's a lot of time we see social media, we just see the big, whoever is on social media, but it's like, who are really the little people that are doing the groundwork, right? What are we doing and how do we get in front of those people? Because there's people that need help. So I do want to say thank you guys for being here, sharing your knowledge. And just really telling people what to do, because again, mental health is at its all-time high, and I feel like, just like you said, we're smiling, we're going to work, and we're doing these things, and no one knows what to do. Like, we are stuck, we are in a hole, and we don't know what's the next step to take. And sometimes we don't even realize that we're depressed, because it's like, if I'm okay, if I can shower, get to work, get back home, take care of my kids, I feel like I'm good. But it's not. Like, you are not okay, and you have to seek help. And seek help does not have to be professional help. Unless it gets there, you need to go get professional help. But it's like finding these safe spaces. We're all creating these safe spaces, and we just have to tell people how to tap into it, right? How to reach it.